To ask before I start?
I don't know your name.
Todd.
Todd?
Todd
Dr.
Binkley.
Todd is what you go by?
Dr. Todd Binkley. You can call me Todd. I don't care. You can call me anything you like. Some people want to know that I'm a doctor, so they call me Dr. Todd or Dr. Binkley. Any of the above is fine with me. I've been in practice since 1989, so I've seen everything, heard everything. Been in this office since 1997. A lot of people ask me, "Oh, is this a house?" Nope. It was built in 1960 by a chiropractor.
Wow.
He built this building, and for his Dr. Aller practiced since the 1920s in that Victorian house next door, and then he built this office in 1960. And he moved the house before he built this office. The house that's behind here used to be, where the park, if you go up Oak Street from Main to Poli, and there's that parking lot on the left, that house used to be there. I've seen the pictures where he moved it up Main Street, put it back there, then built this building in front of it. But it was just, when I moved here, this was all 8-foot cottage cheese ceilings, green shag carpeting. It was really ugly. And there was 2 rooms in a hallway, and I ripped all that out and, insulated and made a big room. So all the dark wood and the arches and everything, I did all that in 97. All right, so we'll have plenty of time for questions afterwards. But most people, how many people have ever had a functional medicine workup? I know some of you have. Or heard of anyone? So what is functional medicine? That's the question that a lot of people have. So it's not standard medicine, for starters. So standard medicine basically is you go to your regular doctor, if you ever go for your annual physical and get blood work done. 2 things are really common. If you get any blood work done, most people think, my doctor checked everything. That's never true. There's 300 common tests. And when you're going for a standard medical evaluation, the purpose of that is to diagnose and treat disease that you already have. To do a few tests, they'll interview you, you'll do a case history, medical necessity. Well, so we'll just finish this slide first. It's on the next slide. So if you don't need a prescription, if you don't need medical care today, then you're told you're fine. But does that mean you're healthy? Anybody? So most doctors are only looking for tests that are medically necessary. And the definition of medical necessity is tests needed to confirm a working diagnosis. So you get a case history, you tell them what you're feeling, your symptoms. The doctor will say, okay, maybe you have diabetes, and he'll order an A1C test and a fasting glucose. Or maybe he'll suspect an infection and order a complete blood count with the white cells to see if your white cell count is elevated, see if you need antibiotics. Or if they suspect low thyroid, if you're overweight and your hair's losing hair and cold hands and feet, classical signs of hypothyroidism, especially in a woman over 50, they'll order one test, TSH, thyroid stimulating hormone, which isn't even a thyroid test. It's the pituitary gland makes thyroid stimulating hormone to tell your thyroid to make more if it's not making enough. And it's a good test, but it doesn't tell you everything you need to know. It doesn't tell you, for example, if your thyroid is making enough thyroxine, T4, is it converting it into the active form? They just assume that it will always do that, and it often doesn't. So these are some of the things that I test on everybody. So most doctors never even consider prevention. And the standards of care that they're governed by, most doctors are employees as well. So most doctors work for somebody else. They work for a hospital, they work for a medical group, they work for some organization with a board of directors that has cost control measures in place, governed by the insurance companies, but they actually get penalized for ordering too many tests. They can lose their bonus at the end of the year. I even knew a medical doctor in Santa Barbara who was working there's a Native American clinic or something up there in Santa Barbara. I forget what it's called. He was working there, and he didn't hardly ever prescribe any medication. He would do a medical evaluation. Insurance would pay for it. Everyone loves that. But he only recommended herbs and massage and therapy, and he got fired. He got fired for not ordering enough drugs. So that's sad, But so that also means that you get the same treatment everyone else gets. The standard of care is designed to make sure that everyone gets a certain minimum standard of care. It sounds great, right? But it also means that if you're not the same as everyone else, and no one is the same as you're as different on the inside as you are on the outside. So a lot of times, If you go to, have you ever been to a doctor? Or do you know somebody who's been to the doctor or been to 3 doctors or 6 doctors? Something's not right. They don't, but they go to the doc, they go to all these doctors and say, oh, you're fine, or we can't find anything wrong with you. If you're lucky, they'll say, I can't find anything wrong with you. They don't say that. They say you're fine. They say there's nothing wrong. They don't know that. How could they know that? If you don't feel right, then something's wrong. And this is the, so that's why a lot of this stuff just flies under the radar. So most doctors focus on early detection, if that, and then wait until something's bad enough to justify it. This is a slide that I pulled. I forgot to delete that part. I pulled a bunch of slides together from different ones. That was from a cancer one. But anyway, so how healthy are you? How do you know? Well, if you feel fine, that means you're healthy, right? Well, heart disease usually has no symptoms. The number one cause of death usually has no symptoms. The most common first symptom of severe underlying heart disease is sudden death from a heart attack or a stroke. Sometimes you feel chest pain, go into the hospital, get a bypass, but far too many still every year just suddenly drop dead on Monday morning because your arteries, I had 90% blockages, feel totally fine. So if you've ever known somebody that's gone in and got an angiogram where they inject the dye into your blood vessels, that's the only way you can tell how much blockage there is. And you can have several vessels that are 90% blocked and maybe feel nothing, or maybe just beginning, if it's 95%, maybe you start to feel a little shortness of breath, or going up downstairs is a little bit harder. But you only feel something when it's 100% blocked, and then you have a heart attack, or until a little piece of plaque breaks off and goes up until the plaque, the piece that breaks off, is bigger than the vessel it's going through, and it blocks it, and that's, you have a stroke. So, well, this guy feels fine because his cholesterol and his diabetes and his blood pressure are all under perfect control. He takes Lipitor for his cholesterol, metformin for his diabetes, and lisinopril for his blood pressure every day. So those diseases are gone, right? No, they're all still there. Stop taking Lipitor, your cholesterol is going to go back up again. Stop taking the metformin, diabetes, your blood sugar is going to go through the roof. And stop taking lisinopril, your blood pressure's, you haven't fixed anything. You're managing those conditions with medication. And these are some of the most common medications, commonly prescribed medications. Everyone's heard of metformin and lisinopril, and anybody not heard of Lipitor? So 3,000 people die every day that are doing this. There are studies that people that take this standard medications. That's why heart disease is still the number one cause. All these people are taking these drugs, and it's still the number one cause of death. It's just delaying it a little bit. So here's an example of one. This is a man that came into me. He was a friend of mine, 62-year-old fit man who was doing heavy lifting all the time. He just knew that I was doing this when he first sort of heard about it. He said, I feel fine. I'm good. I'm fit." And he looked totally fine. But he said, "I want to do this blood workup that you do." And I did. And his blood work looked pretty good, except one of the tests that I do everyone. Oh, it's blurry. I'm going to see if I can fix the blurry here real quick. Usually, if you set it up the same way it was last time. I've got a lot of things that are really small print, so it's going to need to be clear. I'm trying to get the little bit on the left bottom there clear. Is that any better? I can't really see it from here. Okay. All right, well, that's going to have to do. So one of the tests that I do on everyone that most doctors don't do is creatine kinase. And his is 240. The normal is less than 200. And that is a measure of muscle cell turnover. So there's always a normal amount. The normal is not zero. Your muscles are constantly breaking down and being replaced, all your muscles throughout your body and heart muscle. So when creatine kinase is elevated, it might just be because you are working out. I always have to tell people, I try to remember to tell people that are younger. Older people usually doesn't matter, but anytime someone's under 40, we should tell them don't exercise for 48 hours before you get your blood drop, because if you go to a gym or if you do a lot of strenuous workout, just that can make that go up. Well, he's fit. He's doing a lot of heavy lifting. It could have been just that, but I told him, I said, this is not safe. We need to confirm this with a follow-up test called BNP that directly measures stretch on the heart. If your heart muscle, you hear about those people that suddenly drop dead of a heart attack that were perfectly healthy, they're going out for a jog. If you would do this other test called BNP, okay, it'll show up here in another slide. B-type natriuretic peptide is a feedback loop between the heart and the kidneys. So your heart is constantly pumping 24/7, 365 for years. It pumps hundreds of thousands of times a year, whatever that number is, and it never gets a break. So your body doesn't really repair cells; it repairs tissue by replacing damaged cells with healthy new ones. So when cardiac muscle breaks down, any kind of muscle cell breaks down, part of that protein from that process, one of the little peptides in that broken down tissue is called B-type natriuretic peptide. Natriuretic refers to the kidneys. It's a feedback loop between the heart and the kidneys. So if there's an increased amount of that, when it's elevated, it tells the kidneys to dump more water, to release more water to take the pressure off of the heart. So these people that suddenly drop dead that seem perfectly healthy, if you would have done the BNP test on them a couple of months before that, it would already be elevated. But most medical doctors only do that test if you show up in the ER and press the I have chest pain button, because it confirms the diagnosis of heart failure. But it also gives you a heads up way ahead of time if there's any dangerous stress on the heart, because it's produced by exertion of the heart. Too much stress, increased muscle cell turnover. So anyway, I told him, we need to do this test, and that was the test I was referring to. We need to do this follow-up test to make sure that CK is not heart muscle; it's just your skeletal muscle, regular muscles from lifting. And so that he started in July. September, I left a message. November, I spoke to him on the phone. He said, "Oh yeah, I'll do them soon." January, I went by his house, and his wife was there, and I said, "I really need to make sure that he's okay." Well, a month later, he went to his GP with shortness of breath on a Friday. He was given an inhaler for bronchitis. And his wife and his daughter, who both lived there with him, were on a camping trip. They were away on vacation. And they got home and found out later that on Sunday morning he called 911. The paramedics came and he sent them away. He said, "Oh, false alarm, I feel fine." And he was due at a meeting at 10 o'clock at some church thing or something. And they found him on the bed in his suit with his car keys in his hand. Totally preventable. You've done that one test. So don't be that guy. If you're somebody who has, who's been in, somebody that that has shortness of breath, or yeah, 62. And look, picture of health. He was fit, strong. He was outside. He was a gardener, So, and he was anyway. You can't tell. How do you tell? How do you know if you're perfectly healthy? You don't unless you test. So I do that BNP test on almost everyone now. It's an extra $48. The panel that you're going to see here on all these tests, and there's a slide that explains this in more detail. But the basic workup that I usually do on, say, 80% of the patients that come to me for functional medicine, I order this 58-point blood panel, and then I usually add 2 more tests, BNP, which is an extra $48. So this 60-point panel would cost your insurance company about $1,500. If your regular doctor would order that, that's what your insurance company would pay for it. That's why they won't order it. It's literally medically unnecessary. You don't need all those tests to tell whether or not you have diabetes. They are very useful if you want to know if you're healthy or not, and what you can do with better food, exercise, and supplements to fix everything that your body needs support with. So that's why I ordered that on everyone. The BNP test is an extra $48. I often also order serum insulin. I do A1C and glucose. Those are the 2 main tests for. Such a bummer. These were perfectly clear on my big screen at home today. I do glucose and A1C to screen for diabetes on everyone, but serum insulin will start to go up even earlier. Or if you're not sure, if you're eating too much grains, starch, and sugar and not exercising sufficiently to burn that off, insulin running serum, it's extra $20. So I often order that too. So here's a 47-year-old male, came in, had kidney disease. He knew he had kidney disease. He'd been to several doctors. They always told him, the kidney tests are urea nitrogen, creatinine, glomerular filtration rate, these tests here. So one of them was out. Also on this, anytime you get any blood tests done, the standard range is what I call this broad. I like to visualize it like this: the standard medical range, outside of which means that you need a prescription, or you need a referral to a specialist, or you need another scan. You need some kind of medical attention. If you're just inside that range, what happens? You're fine. Come back when you need medical care. So that range on the chart that I display the results on is here. That's the standard medical range. Anything that's outside that range on my report will show up in red. If it's way outside that range, like code blue, it'll show up in blue. But we also have this healthy range. What is it? What does your blood look like when you're in your teens and 20s and everything's working perfectly? And so that those numbers are roughly the middle third of the broad range. The healthy range is roughly the middle third. It varies for each of them, sometimes a lot. But how do we know that? If people maintain their blood in this range, then they have no disease. Everything works fine. So that's a really worthy goal, to see what's outside of those ranges as well, because you can fix those things without drugs. You can fix those things with better food, exercise, and supplements. And so anything that's outside that range shows up in yellow. So if you go to any standard Western medical doctor, they're going to ignore the yellows completely. They're only going to look at the few things that are outside the broad medical range. So this is a man that knew he had kidney disease for years. Every time, for like 10 years, every time he went to the doctor and said, "Oh, there's something wrong with your kidneys." "Oh, well, what?" "Well, we don't know." "Well, do we need to do anything?" "Well, not yet. If it gets worse, we'll let you know." Uh, there's no drug to make weak kidneys work better. You wait till you go on, if you have, especially if you have diabetes, you wait till you go on dialysis, and then cross your fingers and hope you can get a kidney transplant. I see this all the time. People have stress on their kidneys. Their kidneys are struggling. Your kidneys have to work really, really hard. If you've ever seen a kidney, it's cut a cross section. I have some pictures. I should put one up. Anyway, the cross section of a kidney is almost 100% blood vessels. It's just a it's just a mesh of little tiny blood vessels. It's a filter. So if there's stress on it, it's going to cause a lot of serious problems. That's why I screen it for everybody. So, and frequently, if they're out of range, people will say, "Oh yeah, my kidneys have never been right," and no one can figure out. Well, I don't know what was causing his kidney disease either. He doesn't have diabetes. He's pre-diabetic, but he was also really healthy and fit. He owned a moving company, and it didn't matter, because when I get the test results back, I just recommend some nutrients to address some of the specific things that show up on the test, but also some general nutrients. Most people don't get enough minerals in their diet, because even if they eat good food, there's hardly any minerals in the soil anymore. So it's very difficult to get all the selenium and chromium and manganese and zinc that you need. So I always recommend a multi, which is a 4-capsule multivitamin. If you've ever heard that multivitamins are useless, that's because most of them are. And the reason they are is because most multivitamins are one a day. One a day multivitamin. I just want one pill. Well, whatever's on the label is in that pill, but it doesn't mean that it's going to end up in your bloodstream, let alone any of your cells. So the good multis, you can get vitamins from food too. I recommend a good multivitamin mineral supplement for the minerals. So I gave him a good multi, 4 capsules a day for all the minerals that he needs to heal and repair, some fish oil, and vitamin D. His vitamin D was off the charts low, 8.8. A medical doctor will say, most doctors will say your vitamin D is fine if it's above 30. Um, well, what's fine? Your bones won't collapse if it's 30, but if you want your immune system to be strong, you want your vitamin D to be between 50. Well, this is an older one, but you want your vitamin D between 50 and 90. That's the level at which your immune system functions at its peak. And it's easy to achieve that. You just take 5,000 units of vitamin D every day. Most people. If you're way less than 120 pounds, 4,000 might be enough. But most people get 1,000 or 2,000. Those are for kids. It's possible to take too much vitamin D. Medical doctors are brainwashed to think that it's, "Oh my God, if you take 5,000 units, you're going to get a kidney stone." The first thing that happens if you take too much vitamin D is it increases your serum calcium, and if you maintain elevated calcium in your blood for a year or more, then that can start to increase your risk of a kidney stone. It never happens. So anyway, 5,000 units of vitamin D, a good multi for the minerals, and 1.5 grams of fish oil a day I recommend to everyone, just for general health maintenance. That was basically all I recommended to him. A couple of other things to help with his pre-diabetes. I recommend some changes in his diet. And 8 of the code blue tests went to normal. All of his kidney tests were normal 3 months later. This 46-year-old male. So how do you know if you're healthy? You know, the only way to tell is if you test. People, especially men, say, oh, I don't want to know, right? Why would anyone say that? Well, I think they say it because they don't want to find out that they've got some horrible disease that's going to require some huge hassle, something that's going to cost money, take a lot of time, and be painful, right? Well, the best way to avoid that is to find out earlier when you can do something that's inexpensive, doesn't take a lot of time, and causes no pain. Immediately starts making you feel better. So this was a man who had been to his 46-year-old man that had been to his regular physician. He went to every year, and the last time he'd gone in for his annual physical was 6 months before he came to see me. His wife sent him because he was having heartburn. She said, "Can you help people with heartburn?" I said, "Absolutely, do it all the time." And that was all he came in for. And he has leukemia. 6 months ago, he had slightly elevated white cell count. The upper limit of normal for white cell count is 10 or 11, depending on the lab. His was 237. That's why all of these things are blue. Neutrophils are one of the main types of white blood cells that fight off any kind of infection or cancer. 7-point upper limit of normal is 10 times the upper limit of normal. 6 months ago, his white cell, he said he remembered that his other doctor said, "Oh, your white cell counts, it's probably just an infection, but if you're not sniffling, we'll just check it again later." If he had gone a year, he wouldn't have survived. We caught this in time. There is medication for that particular type of leukemia, and that was over 10 years ago, and he's still fine. He has to take that medication, but for some things they have good medications, and that's what medication's for. So he was really glad he came in to find out what was causing his heartburn. Here's a 67-year-old female that had atrial fibrillation. That's where your upper chambers of your heart flutter. And she also knew that she had kidney disease, creatinine high, glomerular filtration rate low. Nobody could ever figure out why. Her cholesterol was 259, and her bad cholesterol was 170. In 4 months, her total cholesterol dropped from 250 to 210, the bad LDL from 170 to 135. The kidneys are fine now. The kidneys aren't completely fine, but they improved, dramatically. And for the first time in 40 years, that's what it was. Oh, the chronic infection. Yeah, so she had low white cell count. That's improving, and the other signs of that were gone. And nothing ever had changed her kidneys before, and now it was. So, do you have stress? Does anybody have stress? This is a woman that came in that had shortness of breath, heart palpitations, and it was getting worse. She'd been into the ER, I think, 3 or 4 times. Nobody could ever find anything wrong. They did chest x-rays, EKG, echocardiogram, everything was negative. She said her blood work was all negative. I said, "Are you sure?" I said, "Did they do a test called BNP?" Because if she went to the hospital and had chest pain, I'm pretty sure that they would. "Oh yeah, there was one test. They couldn't figure out why." And she brought it in, and there it is, her BNP. The upper limit of normal for BNP is what I was talking about earlier that measures the stretch on the heart. Upper limit of normal is 100. And hers was 600 and thought I had it. I thought I wrote it. 685. There it is. Hers was 680. 6 times the upper limit of normal. And her rib cage was, every muscle in her rib cage was in spasm. It just felt like a steel cage. So it was so constricting that not only was it 100% causing the shortness of breath because she couldn't breathe in and out fully. 75% of breath is your diaphragm going up and down. 25% is your rib cage has to expand and relax. And it was constricting her chest so much that it was affecting her heart. It was causing so much stress in her heart that it was shedding cells. 3 weeks later, all those pains were gone. I told her, let's wait till your ribs are completely relaxed. So we waited 6 weeks, and her BNP went down to 20, and all the other symptoms were gone. So anyone can lower their cholesterol. A lot of people don't. More and more people already know that they shouldn't take statin drugs for Lipitor, for cholesterol. Hardly anyone needs to take those drugs unless they have hereditary familial high cholesterol and they've already had a heart attack or a stroke. Then maybe it's a good idea, but anyone can lower their cholesterol without medication. This is a 70-year-old woman that didn't want to take statin drugs, and I recommended 3 things: niacin, berberine, Those are both things that directly help lower cholesterol. And turmeric reduces inflammation. And I recommended that she reduce her intake of grain, starch, and sugar, because if you eat more of that than you're going to burn off with exercise, then that sugar gets converted into triglycerides in your bloodstream, floats around, wreaking havoc, creating inflammation, and then eventually gets shoved into fat cells and stored as adipose tissue. So if you lower the triglycerides by reducing the intake of carbs, that also will often lower the cholesterol. And her cholesterol went from 245 to 184, and bad cholesterol from 153 to 108. So here's another female, 68-year-old, didn't want to take statins, and basically the same program. Her cholesterol, total cholesterol, went down 50 points from 237 to 187, and the bad cholesterol from 151 to 102. So the normal for LDL cholesterol is 100. Anything below 100 is fine. The normal for total cholesterol used to be 240, and there's a lot of research that shows that the healthiest people that live the longest have total cholesterol of about 225. But statin drugs are a religion in the medical. They want to put them in the water. They want to put everybody on statin drugs. They want to drive your total cholesterol down to 100 instead of 200. They want to drive it down to 100. I have some people that come in and their physician has told them they keep dosing them with statins until their total cholesterol goes down to less than 100, which is insane. Cholesterol is an essential nutrient. All of your cell membranes require cholesterol. All of your estrogen, progesterone, testosterone, sex hormones start out with cholesterol. It's an essential nutrient. That's why the range is not 0. But making it super, super low makes no sense. Cholesterol doesn't cause heart disease. It increases the size of the plaques that you already have if you have a lot of inflammation and have created a lot of plaques in your blood vessels. So it's kind of a complicated conversation. But anyway, this is the 58-point blood panel that I do, and most doctors just won't order these tests unless you already have diabetes or liver disease or anemia, or heart disease, IBS, some kind of condition that they suspect requires a more in-depth workup. And so I can give. So some people say, oh, well, will insurance cover anything that you do? They won't pay for functional analysis. They will pay for blood tests if your regular doctor orders them, because that doctor has a contract with your insurance company. Anything that he or she orders is considered medically necessary because she or she ordered it. But again, they won't do this over and over and over again. But if you have a good relationship, or if your physician is younger rather than older, then they often will. I'm happy to email this list to anyone. You can ask, and if he orders all these tests, your insurance will get charged about $1,500, but then you don't have to pay for it. Or I get this panel for $250. And my fees for consultations are $150 per half hour, which is $300 an hour, but it usually only takes a half hour the first time. Sometimes an hour, but most of the time, 80% of the time, half an hour. And then when the tests come back, I analyze the results, bring you back in, explain everything to you, do some muscle testing usually as well to fine tune on top of what the blood tests show, and give you a written list of recommendations for supplements, maybe some changes in exercise, maybe some changes in your diet. So it's about $700 for the basic workup. I often add extra tests for some people depending on the situation. Hormones, for example. Most physicians, if they test your hormones at all, if a menopausal woman is put on hormone replacement therapy, oftentimes when I ask people all the time, did they do any blood tests or anything? No, they just told me to take this. And, we just sort of play it by ear. Whatever. Or if they do test, they'll do blood tests. So your estrogen or progesterone are going up and down, up and down, up and down every 10 minutes in your blood test. So you're getting a snapshot in time. If you do a saliva test to test cortisol properly, to test your adrenals, you have to do a saliva test 4 times a day, because it's a normal curve. First thing in the morning, your cortisol should be high, lower in midday, a little bit lower in the evening, and lowest at night. So this is the normal. This green band is the normal range, and the black line is the test results. So this is a 70-year-old breast cancer survivor. ER positive means her cancer has estrogen receptors on it. So she can't take estrogen, right? Well, she has all these symptoms that a little more estrogen will help, but also more testosterone. So I test testosterone on women as well, because women need a little bit of testosterone. Not too much, but her tests come back. Her adrenals were really low in the morning, so I gave her some adrenal support. That was the result of that. But I also gave her some DHEA. DHEA is the precursor for estrogen, for estradiol, and testosterone. So I'm not going to give her estrogen, but I can give her the precursor for estrogen because I know that if her testosterone is low, her body's not going to make any more estrogen. It's going to make testosterone. That's exactly what I told her, and that's exactly what happened. So her estradiol went from 1 to 1, didn't change at all. Her testosterone went from undetectable less than 6 to 34, and all these symptoms went away, and she was very happy. So I test hormones on anybody that is in perimenopause, premenopause, postmenopause, anything menopause. Saliva hormone test, spit in 4 little tubes, mail it in. It's $220 for all these tests. 4 cortisol tests, DHEA, all 3 estrogens. Estriol has the same functions as estradiol. Most people only hear about estradiol, the standard estrogen. Estriol has the same functions, but it's cancer protective. If you have adequate amounts of it, it actually reduces your risk of breast cancer and ovarian cancer and a couple of others, colon cancer. So, hormone tests. A lot of people are exposed to toxins, which is all of us are exposed to toxins constantly. They're in the air, they're in the water, they're in the food we eat. Some people are exposed to more of them in certain workplaces, in the military, if you work in farming. But in Ventura County, if you sleep in Ventura County with your windows open, then you're getting exposed to chemical pesticides and fertilizers every day. They're in the wind. If you're less than a couple of miles downwind from a field, which is pretty much everywhere in Ventura County, we're breathing that stuff in. If you eat any kind of food that's produced from wheat, corn, and soy, all wheat, corn, and soy, and that's grown in America with conventional farming is saturated with glyphosate, Roundup. The most common pesticide, GMO make seeds that resist that pesticide, so they can just douse it with this stuff, and it'll kill all the bugs, and it won't cause the crop to wilt. So that ends up in your food. So this is just an example. I don't remember who this was, but I see this all the time. Glyphosate will be off the charts, and these are so the 3 main categories of chemical toxins. Um, Actually, there's more than that. It's a little bit too complicated, but industrial toxicants, things that are in fuel, plastics, all the plastics that you hear about, BPA, um, these things show up on the test, and then mold tests. So there's a panel, there's a urine test that covers all of the common chemical tests, in addition to glyphosate, and then mold tests. When you have a chronic exposure to mold, it's not an infection. It's not like you still have mold spores in your lungs or in your sinuses. You can have, this particular patient, I remember I said, have you ever been exposed to mold? He said, oh yeah, when we moved out of our house like 7 or 8 years ago, when we moved out of the garage, there was a bunch of boxes against the wall, and when we moved those boxes away, there was a bunch of mold behind there. And he never knew it was there until they moved out of the place. I think it was like 10 years before, 7 or 8, 10 years, but it doesn't matter, because if your body gets exposed to the metabolic waste from that mold, then those toxins do this. The same thing happens with the toxins that the mold produce as a chemical toxin from fertilizers, from pesticides, from an industrial exposure. Your body, if you get it, and same thing with heavy metals. If you live in Flint, Michigan, and drink the water and get a bunch of lead in your system, your body, your kidneys, and your colon will flush as much of that out as it can in a few days. So that's why they don't show up in a blood test, because they're not in your bloodstream. Your body works really hard to get all that stuff out of your bloodstream. But what it can't flush out completely through the kidneys and the colon, if it's still in your bloodstream and it can't get it out, it shoves it into fat cells just to get it out of circulation. So it's not irritating your brain, and it's not irritating your immune system. Your brain is the most sensitive organ to any kind of toxin or nutrient deficiency. So it's just a survival mechanism. So when we test these things with the urine test, that's what we're finding. We're identifying these things that you may have been exposed to 10 years ago, and they're still just sitting there in your fat cells. Tiny amounts come out when you sweat. How often do you sweat? So some people sweat a lot, and they will tend to have less. That's one way that your body can naturally still flush that out. But most people just have no idea. No one has any idea how much of these things they have unless they test. And so often, when somebody has any kind of autoimmune condition, lupus, multiple sclerosis, Hashimoto's thyroiditis, um, any kind of rash, um, and anything to do with the brain, so anxiety, depression, early onset dementia, um, often toxins are involved. And most doctors never test for that. And because there's no drugs to really treat that, there are things that you can take to help your body flush those things out more efficiently, safely, slowly. But I've seen some of the most horrible rashes imaginable. You know, oozing, pus, pink, oozing, slimy, all on this one man in particular I'm thinking of, on both arms and up and around the back of his neck. I said, this is going to take 4 months. And he came back in like 3 months later. And he's taking all the stuff I told him to take. He's taking. He said, "Yeah, I'm taking everything." And he was using profanities. He said, "I don't feel it hasn't changed." I said, How long did I tell you it was going to take? 4 months. It's been 3 months. Hasn't changed. It won't change until you got to flush all that stuff out and then allow your skin to heal. And right around 4 months, it went away. And that was like 5 or 6 years ago. It's never come back. So how did I figure out the 4 months? With muscle testing. So it's not a slam dunk. It's not a lock, but you can get information that you can't get from standard tests. You can get information directly from your body. So I use that for dosing supplements. How much of this is just the minimum amount that you need? How long do you need to take it? How long is it going to take to experience some symptom change that you want that answer? I can give you an idea with that. So this is what a heavy metal test look like. You can test heavy metals in urine as well, but I often do it in the hair. And some of these are just for research purposes. And sometimes it's useful to measure all the healthy minerals, the essential minerals. It doesn't really matter if any of these are super low unless they're all the way down in the red range. So like sometimes if somebody's germanium is in the red, I might supplement that depending on their symptoms. But the main things we're concerned about are arsenic, cadmium, lead, mercury, and uranium. So you can see this person's mercury is off the charts. The reference range is below 0.8, less than 1, and this is 14. So it's like 15 times the upper limit of normal. It's off the chart. And, lead and mercury are there. Uranium is one of the heaviest. And if we're going to say on the next slide, um, this isn't measuring how much is in your body, it's measuring what's coming out in your sweat glands as your hair grows out. So they do drug tests with hair that way, and heavy metals. It's an easy way to just measure what your body is able to excrete on its own. So this is what it looks like when we do a series of those. So here's a man that was 69, I guess, in the first test. And he's got really high arsenic and tin. Tin isn't super toxic. Antimony is similar to arsenic, but not as toxic. And then this last line, it says total toxic representation. So they do a weighted average because some of these things are more toxic than others. So they give you as an average or overall indication of your total toxic burden. So again, this is just showing what his body's able to flush out right now through his hair follicles and sweat that accumulates in the hair. So I put him on some things to help his body flush those things out. And when we see that, sometimes I'll see someone that has really, really low lead and really low cadmium, really low mercury, and I'll tell them that's not good. That doesn't mean that you don't have any. It means you're a poor excreter. I see this like at least 30, 40% of the time. If everything comes back low, that's never normal. How do I know that? Because if I give them the things that help your body flush those things out better, they always go up on the second test. Well, that also happens in any circumstance. The whole purpose of this is to identify what's coming out now, facilitate that excretion. So mercury was his highest here, and put him on the program to help flush that out. So when we tested him again, more is coming out. That's what we want. We want his body to flush that stuff out. We're not measuring what's in there with a hair test. We're measuring what's coming out. Well then, and I usually only do this a year, 6 months to a year later, sometimes more. Anyway, you can see the end result however many years later. I'm sorry this is so blurry. It was perfectly clear on my screen this morning. But say here's his mercury. It was 3 point. It went from 8.9 to 3.2, and now it's that whatever that is, 5 or something. Obviously way down. The antimony is the one that's still high, but you can see the total toxic representation. Even though the antimony went up, it's not that toxic. So the total representation went way back down. And the other bad guys, the mercury, lead, cadmium, uranium, and arsenic are the ones that are really important to go down. And he felt so he had some early signs of dementia, and his brain was clearer. He could focus better. He was forgetting things less. That's one of the things that can happen in any kind of autoimmune condition. So sometimes I'll also do a stool test on people if I want to measure their microbiome. How is their gut doing? If they have intestinal symptoms, gas, bloating, diarrhea, but also mood disorders, anxiety and depression, or any kind of brain issue. A lot of the neurotransmitters, there's more receptors for serotonin, the feel good neurotransmitter, in your gut than in your brain. So gut tests. This is a woman that she had diarrhea for 6 months, and she had been to Thailand on vacation. She just figured that she ate some bad food there, because that was when it started, right when she got back from this vacation. She'd been to several doctors. No one could help her diarrhea. I said, well, let's do a stool test, and we'll probably find whatever bug it is that you got. But the important thing about stool tests is that, and this is an abbreviated test. The normal stool test they do is 16 pages, and it tests for every virus, every worm, every parasite, every bacteria, yeast, with microscopy, culture, 6 different versions. It's the most comprehensive test there is. It's called GI 360. She couldn't afford that, and I said, well, let's just find out what your normal microbiome is, and if there's any major um, pathogens, we'll usually catch those. And she had none. Dysbiotic flora. These are the pathogens over here. She had no bad bugs in her gut, but her normal microbiome was hugely deficient. 2 whole categories of the main uh, um, types of bacteria that constitute a healthy microbiome. None of them. No, none of these. None of these. And so I just gave her some things to help her body build back. She was getting sick all the time. She was still getting any kind of there's bacteria in your food every day. If you don't have sufficient hydrochloric acid in your stomach, that's how you get those things in the first place. Sometimes you can eat the same food as the person next to you. One gets sick and the other one doesn't, because one has more acid in their stomach to kill the bugs before they get to your gut. So I put her on some hydrochloric acid to support that, some high dose, really high quality, high dose probiotic, and some prebiotics to feed the healthy bacteria in her gut. So some types of soluble and insoluble fiber, chickpeas as beans. Sometimes people can tolerate different things, but anyway, uh, yeah, it took 2 or 3 months. It was better in like 3 weeks when she started the program. It took 3 months, 2 or 3 months to get it to go away completely, and never came back. So these are some of the other labs, in addition to the blood work. I do blood work mostly with LabCorp, sometimes with Quest. Doctor's Data does the stool test and the hormone test. And these are just some other doc. Mosaic Diagnostics is the best lab for the chemical toxins. Here's an 82-year-old female. I love this one because she was a patient of mine for many, many years, 10 years, mostly coming in for chiropractic. She was a violinist, and her neck was just stuck this way. Every time she'd come in, she'd say, how come my neck is always tighter on this side? And I say, well, did you ever hold anything between your head and your shoulder for 60? Oh, yeah, okay, I remember now. But anyway, she told me that her blood pressure, she'd gone to her doctor. They wanted to up her blood pressure medication. She was feeling dizzy. She didn't want to take it. I said, well, how high is your blood pressure? Oh, for over 30 years, it's been nearly 160 over 90. She refused to take the medication. Every time she went to her doctor, tried to get her. She was thin, otherwise really, really healthy for her age. She was a force of nature. She directed a play in her church in LA every year. She was unstoppable. But I said, it's not going to last. You need to get your blood pressure under control. So I said, well, have you ever tried fish oil? Yeah, I tried it. It didn't work. How about pomegranate juice? Yeah, I tried it. It didn't work. How about turmeric? Yeah, I tried it. All of these things. Everything I asked her, oh, she tried it all. I said, did you ever try all of these at the same time? Well, no. Why would I do that? How would I know which one's working? They don't work by themselves. They're not drugs. They're synergistic. When she took all of these things, 6 weeks, her blood pressure went down to 130 over 85. Basically normal, especially for her age. And she didn't have to take all those things forever either. After a while, we take them. You want to take everything. When I do the blood work, I identify a whole bunch of things, a handful of stuff that I usually recommend you take for 3 or 4 months, and then we take them away one at a time, 2 or 3 at a time. When your body no longer needs that, you want to consider your bloodstream a river of life. There's a poster out in my waiting room, and sometimes it's even outside the building. Imagine your bloodstream as a river of life, and on both banks of the river, there are construction crews waiting to heal and repair your kidneys, your liver, your digestive system, some part of your body. And they're waiting on the materials they need. But if the materials aren't there when they need it, then they're just sitting there waiting. So that's what if you feel like you're getting old, raise your hand if you've ever just felt something wasn't working. Oh, I'm just getting old. Well, no, you're just not healing and repairing normally as well as you used to. And if you flood your river of life with all the nutrients it needs to heal and repair everything right now, then everything starts working better. And then you take the things away as your body heals and you no longer need those, and then get back to a core long term. I recommend everybody take the multivitamin for the minerals, 5,000 units of vitamin D to keep your immune system strong in your bones, and about 1.5 grams of omega-3s from fish oil. Sometimes older people also benefit from long-term supplementation of B12 because it's difficult to absorb and difficult to get from food, especially if you don't eat beef. Vegans, vegetarians especially. Some people benefit from a supplement called nattokinase and serrapeptase. It's called nattoserozymes, systemic enzymes that help both with arthritis and the scar tissue that builds up that causes hardening of the arteries. So those are some of the things that people benefit from long term. So what can I help people with? Brain fog, cramps, constipation, bloating, allergies, all of these things. Anybody that has any of these conditions, there's a very good likelihood that I'll be able to help them, even if they've been, especially actually, it's more likely that I'll be able to help them if they've been to other doctors and those people couldn't help them, because that means no one's found what's actually causing it, because it's usually not one thing. It's usually a collection of things. So don't wait till drugs and surgery are the only option. Identify all the places where normal function isn't working like it should, and then restore optimum health with better food, exercise, and research-based supplements. And here's some things that anyone can do just to take care of their health all the time. That reduces your risk of almost every disease. And if you want more information, you can go on my website. There's some video testimonials there, also on my YouTube channel, binkleyhealingcenter.com. So functional medicine, focused analysis of the results to find earlier signs of stress on various parts of your body, facilitates something that is beyond the reach of any drug: the restoration of normal physiology. Any questions? Connie?
I missed the arginine. What was that?
Arginine?
Yeah.
So arginine also, arginine helps boost nitric oxide, and it was a kind of a fad. It's still, a lot of physicians still use it. It does boost nitric oxide, which helps lower blood pressure, helps reduce inflammation. Your body makes it from protein, so a lot of people are deficient in hydrochloric acid in their stomach. Just taking hydrochloric acid can boost nitric oxide levels. I don't use arginine anymore because there's another supplement that came out about 5 or 6 years ago called citrulline. The product is Citranox, and that works way better. It lasts longer in your bloodstream. Arginine doesn't stay in your bloodstream for very long. It's inexpensive, so it's fine to take, but citrulline works way better mainly to lower blood pressure.
What I like about your supplements is they're not filled with colors and stuff. I've taken stress stuff from another place, and your urine is bright fluorescent yellow. Whereas your supplements, I noticed.
Yeah, a lot of things just go right through you. The one-a-day multivitamins, I've seen them on X-rays just floating through people's intestines. The most expensive supplement you'll ever buy is one that does nothing. Or the biggest waste of money, I guess. It just passes through you. So yeah, there's some vitamin C, for example. If you can tolerate ascorbic acid in the dose that you need, you can buy it at Costco. It doesn't matter. It's ascorbic acid. Some people need a buffered form if the acid bothers the stomach, if they have GERD, or if they've had ulcers. They might need a buffered form, but apart from that, you can buy vitamin C anywhere. It doesn't matter. Vitamin D. When COVID was happening, I told everybody, get large amounts of vitamin C and large amounts of vitamin D. You can get vitamin D at Costco too. It won't work quite as well as the top shelf brands. When I would see people's tests, they're taking 5,000, just like I always say, and their vitamin D would still be a little low. It seemed like it was about 15% less effective, so it's better than nothing. But there's some things you'd never buy. Never buy cheap fish oil, because the oceans are full of toxins, they're full of mercury, and all animals store those toxins in their fat, and they don't have to test it. There's no law that says you have to test your fish oil to make sure it's clear of toxins, and the top shelf manufacturers do. And I only sell fish oil or recommend fish oil that I've seen the testing data, and they don't give that information out. I had to twist the arms of the representatives from those companies to get them to show me that data, and I had to promise not to, put it on my website or show it to anybody else, because that's proprietary. It's very expensive to purchase and maintain the equipment that filters that stuff out without destroying the nutrients, and then they can test it and show that it's low in mercury, it's low in plastics and all the stuff that ends up in the water, in the oceans. So that's why you don't want to buy cheap fish oil. And a good fish oil for a standard dose of a couple gels a day costs about $55 or $60. So if you're buying something that's $25 for 120 capsules, don't give that to your dog. And there's lots of other things that are in between. So.
And when your blood panels, you have to fast before those, right?
Yes. So
And
the
then
fat.
do you follow up panel in 3 months? Or?
Usually 3 to 4 months. I sometimes we have to do the whole panel, just depending on how much shows up. If you're one of those people that had a whole bunch of things out of range, we might do the whole panel again. But most of the time, we just do, 3 or 4 or 6 tests. I'll redo the metabolic panel. Let's go back here. So a complete metabolic panel. When you get, if any doctor orders blood work on you, they're going to do a basic metabolic panel. Typically, it'll include your electrolytes, your protein, your kidney function tests, and they'll maybe add liver function tests. So you can get most of this separate from the whole panel. I can get it for, I think, $20 complete metabolic profile. Right, Victoria, do you remember? It's about $20. Same thing with the CBC, a complete blood count with a differential with all the white cells. Just that is about $20. It's when you start adding ferritin and serum iron and GGT and CK and LD, some of these other ones, is what makes the price go up very quickly. So yeah, a lot of times we might, in 3 or 4 months, we might just order a few tests that cost $100 instead of $250 or 50 or 60, something like that. Just whatever's out of range that we're looking to see a change in. Like cholesterol, if somebody has high cholesterol, we're always going to test that in 3 or 4 months. It takes that, you can't test it earlier than that because it takes that long for it to change substantially.
Your basic, like the
So that basic workup that I mentioned before is just the blood panel. If someone has menopausal symptoms or any other hormone-related symptoms, anxiety, or fatigue, because it includes the adrenals. So anybody with severe fatigue, difficulty getting up in the morning, or difficulty staying asleep, adrenal function, I can just order the adrenals for about $100. On men, I just order the adrenals and DHEA and testosterone, and that's like 160. For the full panel with everything, it's 220, which is pretty cheap for what you're getting. And it's more accurate because you're getting an average instead of just the up and down snapshot. You're getting an average throughout the day. How do they do that? You spit in the 4 tubes to get that progression of the spit in 4 tubes. So we see that cortisol curve, and then they take a little bit from each one of those 4 tubes and make a fifth one to test the estrogen, the progesterone, and the testosterone. So you get an average throughout the day. And all of those things work their way from your capillaries into your saliva. The equipment has to be 10 times more sensitive to measure it, but it's also much more accurate. And the other thing about that is if you, especially menopausal women, if you're going to take hormones, most of the time when you're just getting your endocrinologist or your GP just guesses and say, okay, take this estrogen and take this progesterone, they never test you, and they just ask you how you feel and raise it or lower it accordingly. Most of the time when I see, and oftentimes that works because if they're really low, it'll work for 6 months or a year, and then they come in, and the symptoms of too little estrogen and too much estrogen are the same. Have you ever heard of insulin resistance? Diabetes, right? Your cells, your pancreas is overproducing insulin to try and keep all the sugar that you're eating out of circulation and shove it into fat cells to get it out of the way, because hyperglycemia is what causes all the damaging effects of diabetes. It damages your nerves and blood vessels, causing your feet to need to be trimmed, and heart disease and strokes and all the rest. But your cells can also become resistant to estrogen. Your cells can also become resistant to progesterone. So taking too much has the same symptoms as not taking enough because your cells stop responding to it. I see that all the time. People who are already on conventional HRT with prescription medication, I'll just tell them to stop taking progesterone for 3 months or 6 months, and they feel better. Because and when you're doing if you're taking any topical, if you're taking pills or injections, then a blood test is accurate for that. But if you're doing any kind of cream or a patch or a suppository, those things are mostly bound to red blood cells, which means they're not in serum. When you get your blood drawn, they put it in a centrifuge, and so the red blood cells sink to the bottom, and then they pour off the serum. Most blood tests are serum tests. So if the thing that you're trying to measure is bound up to red blood cells, it doesn't show up in serum. Some of it does, but only about a third of it. So you're not getting an accurate measure on a blood test if your progesterone cream is working or not. And you do get, and so most women, that menopausal women in particular, need very little. If they need anything, they need very little doses of plant-based bioidentical estrogen. Bioidentical. Everyone thinks, yeah, my endocrinologist told me I'm getting bioidentical hormones. Well, what tests did they do? Oh, they didn't do any tests. Well, then how do you know it's bioidentical? What does bioidentical mean? It means that you're not just giving some standard dose, you're measuring your levels of estrogen and progesterone and giving an amount that will make that back to normal. If you don't test, there's no way you can do bioidentical because you don't know what your normal is. So, any other questions? All right. Well, thank you very much for coming. We're doing this every month, same first Wednesday of the month. And my radio show is on. Veronica, can you give Pam and Matt one of the? My radio show is on 98.3 FM every Friday at 2 and Saturdays at 3:30. All the past episodes of that show are on my website, on Spotify, on YouTube, on Apple Podcasts. If you like listening to podcasts, all the live shows that are on the radio each weekend are saved as a podcast later, so you can listen to them whenever you want. There's over 100 of them. You can search for different topics. Yeah, if you're interested in Alzheimer's or high cholesterol, you can search for any of those things, and I'll have a talk about it somewhere. And we have a health fair coming up this 3 weeks from now, July 18th, right here, in here, and outside in the parking lot. Mostly, we'll have 15 of the top holistic health practitioners in Ventura area from 11 to 3, doing demonstrations, qigong, dance, acupuncture, all kinds of stuff. And there's flyers. What was the date? July 18th. There's a big sign outside the office. You can take a picture with a QR code that'll take you to the Eventbrite if you want to register. There's also flyers up here. Okay. Yeah, love to have you. July 18th, 11 to 3.